Welcome to an overview of ChartLogic's practice management system to complement the ChartLogic electronic medical record, which are interfaced together for an all-in-one solution. The ChartLogic practice management, as you click over from the EMR with the push of a button, this skin will open for the practice management. The dashboard will show first, which is a quick overview of how your company is doing on the right. They're reporting here. Now there's ample system, but this is a quick snapshot. Keep in mind that each user that logs in can have their different permissions. Some might be able to see this and some not, and that goes for every module in the system. The manager of this system can decide on different user types, different roles, and individual access as well. You'll see in the middle here, message, inter-office messages. The great thing about these messages, it works just like an email that you can select multiple people or groups, and it will link you to the exact item they might be speaking about, an exact bill, an exact appointment, and whatnot if you link those in. You'll be happy with our training. Our training library has hundreds of hours of in-depth training videos, but you know, if you like the person-to-person, just call us up. We're right here, US-based service. There's no extra charge. It's rolled into your monthly fee to have training and support and ongoing help whenever you need to. So just give us a call if these videos don't suffice. On the left-hand, see updates that we generally give to all of our customers, new releases, any updates such as 5010 a bit ago. ICD-10 is coming out. We're ready for that in the system. And you'll find any type of support messages over here. If I minimize this, though, you'll see that this is an icon-driven practice management. It was designed by billers 15 years ago, and with over 15,000 providers currently doing their billing with using this practice management system in the United States. From the left to the right is your day, patients, all the way through reporting. Let's go through these icons one at a time, and we'll save it for other videos to do the deeper dive. The blue is your patient, their charts and their financial history. Plug in their insurance in here, scan a card, and order the insurance. We'll go through those. But great flexibilities within the system. Create forms that interface with Microsoft Word, consent forms and such. Save them here. See a full financial history, visit history. Very ample but simple system at the same time. The red is going to be your appointments and calendar events such as recalls and checking a patient out and setting them up for a new appointment. You'll find that the appointments, the highlight here is how flexible they are. Different schedules for different providers, different rooms, different pieces of equipment that you can cater to the individual need, as well as e-eligibility is in here. The green is your money. For bigger, complex offices, we have batch entries, so you can organize via batches all of your to-dos and your billing. Unlike chart slips, this is on the electronic medical record side as well, but the chart slip, the super bill is here, especially on the EMR side. What's nice is the E&M coder and suggester, or the diagnosis director. They'll help you choose which level to code at, suggest what you might need to do more to bump up that level of charge. A quick charge entry, any bill that we need to quickly give a patient can be done here. And then the money down, money up, money down. The money down is your quick pay. Take a payment from a patient or an EOB that came in on paper. You need to do it by hand. Plug it in right here real quick. The transaction entry, about the same thing for a patient, any kind of transaction that they might have. Plug it in here. The end-of-day wizard is a great tool for organizing your to-do list, especially amongst several employees. You can include anything in this end-of-day wizard, certain claims that you need to go through, certain reports, any kind of to-do, plug it in here, run this. It's the end-of-day wizard, but do it throughout the day if you need to. The claim center, you won't find a better claim center. Very intuitive, and you can scrub these claims. You can modify them along the way as they're going through our system and through the clearinghouse. We have a 95% guarantee on this claim center that 95% of your claims will pass through to the carrier and be paid to you, be accepted the first time. Far less reworking in this system, 8.5 million CCI edits. We have on our side of the table so we can scrub these within minutes, if not hours, and show you what's wrong with these claims that you're putting out so you can fix them quickly and get paid on time. You'll find a boost in your revenue, not only speed of the payments, but positive editing. We'll find things that you might have missed and capture more revenue and suggest more revenue for you. The Claim Submission Wizard helps you submit any kind of paper claims and track them as well. Whether it's electronic or paper, our system will track it, generate it for you, and help you push those out. The e-remittance is your EOBs coming in electronically. Just about any carrier uses this now, so you can have them all electronic. They're parsed for you. If you've ever seen an EOB on paper, that's just a big mess of letters and numbers and patient names. And you've got to parse them yourself, look them up, and especially reworking a claim or a denial is a headache. That our EOBs will be parsed for you, separated, and very clear. Penny by penny accounting in this system will trace every penny that that you've charged and received right back to the original appointment, to the patient, to the carrier, to the T, so you know where every penny is. A collections module, very ample. Everything's in here. We're just not connected to the reporting, TransUnion and such. But everything else that a collections agency would need is in here to track your to-do list, to draw up statements and letters to mail out, and put a patient on a payment plan and such. Yellow's my reporting, and it's ample reporting here. Our report center has over 180 different reports that you can modify the bounds and drop those reports. Our flex reports are a bit nicer than that, and especially our ad hoc reporting will enable you to create any custom report that you'd like with bars and graphs and charts to really keep your company up to speed with how it's doing the very moment of every minute. You'll see that it's very Windows-based, that the menus up top, besides the icons, is a great way to find out where you need to be. And without any training, you could go into these master files and utilities and set things up yourself, although we'll give you plenty of training. It's very easy to understand and do. And you'll notice at the bottom of my page, everything that I've opened up will pop down here as I like to multitask. Different patients can all be seen at once. Will pop down here. Maybe I'm doing different EOBs or claims, and you can save your to-dos all down here so you can multitask easily. At ChartLogic, our biggest goal really is to keep you one of the best practices as far as tracking and generating revenue. So you know where every penny is, you know where to be efficient, what works, does not, and I hope you've enjoyed this. Look through the other videos to see an in-depth couple minutes on each different module of this system and how it can improve your office. And feel free to call me, Jason House. I'm a sales rep at ChartLogic, and I can send you through, send you a go-to-meeting invitation to get you into this practice management system and do a one-on-one consultation of your needs and how this practice management system can adapt to your office. Thanks. Have a good day.